Dr Myers, you're a palliative care specialist working in a hospital. What difference would Lord Joffe's bill make to your work?
My concern would be for many chronically ill patients who find themselves in hospital where palliative medicine is probably least well resourced and where dying is probably the most unpleasant of any environment. And at the moment in this country, 50% of people die in hospital. And I suppose the difference I'm concerned about is pressure of resources is such that patients would feel very subtly pressured themselves to think about this as an option for their treatment.
We know we have an ageing population. Are you saying, to put it crudely, that hospitals would find it cheaper to assist these people to die than to treat them?
There's no doubt that that would be true as the population gets older. I think it would be far more subtle than that. I think there are some patients who clearly express the fear that they're being a burden to their families and would want that burden to be lifted, and that might be a good route out of the problem. There are some that make it plain they don't want their savings spent on nursing home fees because they'd rather leave it to the family. And I think there's a big pressure on doctors to move people through the system as quickly as possible because resources are very stretched and there's always somebody else waiting to take the bed. And I think put that together, and not through malice at all, people could really find themselves being subtly persuaded that this should be an option that they seriously consider, and for the good of their families and society, to think about ending their lives.
Lord Joffe is arguing simply that adults should be allowed to make adult decisions, that this isn't a matter for doctors such as yourself to decide.
Well, I'd say two things to that. First of all, autonomy is never absolute. We all obey the laws regarding speed limits because they're there to protect others. And I think we have to put limits around autonomy in this situation because there will be patients who are vulnerable and at risk and who need protection from the law, from undue pressure being brought upon them. And yes, doctors are powerful, but I fear this legislation would just make them even more powerful. What concerns me particularly is that in the Netherlands, only 50% of cases of euthanasia are actually reported to the body that's been set up to regulate it. And it's as if, now that euthanasia is an accepted part of medical practice, there are some doctors who feel at liberty to practice beyond the law. And I see this would be giving doctors more power over patients and diminishing the autonomy and power of the most vulnerable.
Opinion polls suggest that overwhelmingly the public favour assisted dying. In your own experience, how often do patients actually ask for it?
Very, very, very seldom. And I think that demonstrates that public opinion is probably the view of the worried well, and that when people actually are very sick themselves, they realise that even a little bit of life with some suffering is better than no life at all. I've come across patients who've made quite detailed advance directives. I can think of a young man with AIDS that I looked after, who made it quite plain that if he lost his sight or the use of his limbs, he would wish to be allowed to die. When he did lose his sight, some months down the line, his view was completely different, and he realised he would rather live with no sight than die. And I think that would happen to many people who, when they're walking down the high street, fit and well, think that euthanasia would be a good idea. But when it's them, if it ever is them, they have a completely different perspective.
What about the process of dying, the procedure? Do you have anxieties about how that would work?
I think euthanasia is often advocated as being the dignified, painless way to die. I think what's less well known is that giving drugs in that way is like any medical procedure. It's got side effects and complications. And there's certainly published evidence from the Netherlands that it does go wrong. Patients are either very sick, or some have fitted, some have remained unconscious, then woken up some hours later, which doesn't strike me as dignified at all. I think with good palliative care, most deaths can be very, very dignified and comfortable. What's needed is the expertise and the environment. And the tragedy is that in many hospitals, neither of those are present sufficiently to enable all patients to die with dignity in that way.